We interrupt programming right now because we want to take you to the governor's mansion in Denver. Governor Jared Polis providing an update, a live update on what's going on with COVID-19 here in Colorado.
So this is a better environment without sacrificing transparency, which is so important to us as a value. We want to make sure that as a leader of Colorado, members of the media, members of the public have every opportunity to ask whatever questions are on your mind, and that's what we'll be giving you today in a few minutes after the presentation. First, an update on the numbers. We have now 1,154 people hospitalized in our state with COVID-19 and 190 deaths. And our thoughts and our hearts go out to every family who's experienced loss because of COVID-19 in Colorado. These numbers are growing. We expect that while the stay-at-home and the work that's being done, and so many of you are staying at home and wearing masks if you go out, while that is having an effect, that's a delayed effect. And so we are still expecting significant tragic loss in the days and the weeks ahead. Many people who contract the virus worsen after 10 or 12 days, need hospitalization. Some make it, some don't. As you know, on Monday we took action to extend the need to stay at home to a date, April 26th, that we have confidence in that. Reaching that date, achieving that date really depends on people's ability to stay at home. We need to stay at home. The more people stay at home, we can hit that date or sooner. If people are failing to stay at home and mixing unnecessarily and spreading the virus, that date could have to go longer if the deaths continue to pile up. But at this point, based on the data we have and the data that's emerging, we feel confident that we can achieve that date, that you can achieve that date by staying at home and by wearing a mask if you absolutely have to go out. This is also both a wonderful but also a challenging time of year for most of us in different faith traditions. It's Easter Sunday for those of the Christian faith. Passover starts tonight for many Coloradans like myself of the Jewish faith. Those who are secular or humanist often celebrate rites associated with the spring equinox that's coming soon, a week after Easter. There's Orthodox Easter for Eastern Orthodox, Greek Orthodox after the Christian Easter. We have with us Reverend Amanda Henderson, who will speak for a minute about what some of the Christian faith traditions are doing around Easter in Colorado, and some additional guidance to make sure that the Easter holiday can be as meaningful for us, and that we can, Coloradans can experience as much fellowship as possible around the important celebration of the resurrection without endangering themselves through physical proximity. We know that staying at home is hard, and for many of us it's even more hard with the religious holidays coming up. The Easter holiday is one based in hope. It's about resurrection after suffering and trust that there will be a new hopeful day. And the Jewish tradition of Passover, which begins this very evening, is about liberation, the exodus from slavery and oppression into the promised land, and of course commemorating the 10 plagues which were necessary to get people to freedom. There's a Hebrew song that in Jewish families across the country, including mine, we sing every year, called Dayenu, which in English means it would have been enough. It's a song that counts the blessings we have. And so too, while these are challenging times, it's also a time that we should all count the blessings that we have. Those family members that are healthy and are with us, the friends that we have, whatever we have in our own lives, to celebrate. It would have been enough. It would have been enough. And let us count those blessings, despite the challenges that so many people face. If you've lost your job and don't know where your rent is coming from, if you're not sure whether your employment will keep up, if your business has been closed because of the COVID virus, if you cut hair and you're not allowed to do that in your salon, if you're a nurse or doctor that does elective procedures that have been put on pause, if you're a patient that needs one of those elective procedures and can't get that done right now and suffers, knee pain and you need a knee replacement. All of those folks, a lot of real challenges. I think that the best philosophical way to approach that is Dayenu would have been enough. Count the blessings on the other hand. You have this challenge, and this challenge, but we have this blessing and this blessing and this blessing as well. In just a couple weeks, our Muslim friends here in Colorado, across the world, will be celebrating Ramadan, a holiday where observers are tasked with doing good deeds towards others and putting forth the very best version of themselves in service of God. And I think that all Coloradans, secular, religious, of every faith, can really draw inspiration from these holidays that are upon us. And I know that in person, in the case of Easter, and in home, religious services, in the case of Passover, are a key part of these celebrations. And for many of us, our faith and spiritual community are absolutely critical for emotional well-being, especially in a time of crisis. Unfortunately, this year, those plans are going to look a bit different than they have in previous years. Some of you might have seen the almost surreal image of Pope Francis last week, standing alone, addressing an empty St. Peter's Square in Vatican City. A stark contrast to the crowds that often materialize there. Of course, Italy, one of the worst hit countries from COVID-19. And while that square might have been physically empty, the words of the Pope, the power of faith, reached the hearts and minds of Catholics across the entire world. And we hope that spiritual fulfillment will be there this holiday season for all of us. And even if some traditions around the exercise of our faith need to be adjusted in new ways to address the respect that we all have for the sanctity of life and the real danger of this virus to congregants. It was really just a year ago, last Passover, that in this very hall that we stand in here at the Governor's Mansion, I hosted, as the first Jewish governor of Colorado, a Passover with about 150 people, very large Passover. We had a boisterous table of children over there. We had legislators of the Jewish faith and their spouses and others and family friends, really in a large, I don't know where we got the table. This table was like 100 feet long. It filled this whole corridor here. And part of what Jewish families do to honor the Passover tradition, as well as their guests, many Christians also honor and remember Passover in different ways. Of course, the Last Supper of Jesus was a Passover Seder, and many members of the Christian faith are invited into Jewish homes to help observe this meaningful event. But we had 150 people here and took turns reading the Haggadah, the traditional document, all around. Now, of course, not only will this Passover there not be any kind of event like that, but also there's often an intergenerational getting together. So this holiday, my family, like so many others, my parents, Grandma and Papa, are going to be safely in their home. We'll have a iPad up showing them. We'll have our cousins and their kids, similar to our kids' age, that we often observe Passover with, that will be in another chair with an iPad. And we'll do our best, and that's what families are doing, because nobody wants to put, Grandma and Grandpa at risk, those aunts and uncles at risk, and that's extremely important for the in-home piece for Passover, and also for the in-church piece around Easter, which is coming up this Sunday. Faith leaders are holding smaller events with 10 people or less to safely accommodate worshipers. And what so many faith leaders across the state are stepping up and doing is providing online streaming and viewing of those and making sure that they're able to offer online services or drive-in services. We have a pastor group of people and we have Amanda Henderson, who is the executive director of the Interfaith Council, also the co-chair of the Governor's Clergy Council. And many larger churches requested, how do we do a drive-in service where we use our parking lot facilities and either sound amplification or a radio signal, and can have people together but safely apart, and some churches will be doing that. Online streaming, for our larger churches, this is a production, and that means, if your production normally has 12 or 15 people, you need to have less if you can. And I know there's a camera person, an audio person. You might have to have somebody who performs a song. It's unlikely to be a choir in the sense that it used to be. That could be a very dangerous situation for members of that choir. But the online streaming ability needs to be there, and so many churches across our state have done an amazing job, and I know they're going to do an even more amazing production for Sunday. Other pastors have invited their congregants into their home. Now, figuratively, not literally. They're not physically there, but they've shown intimacy with members of their church by projecting from their own home library or study and really reaching a form of intimate fellowship in a way that can even be more effective than some of the traditional ways that those houses of worship operated, especially in these challenging times. So many faith leaders of all denominations across our state have risen to the occasion every Sunday since this has began, and will rise to the occasion on Easter Sunday. Next slide, that's the online streaming. Drive Up, as we mentioned, there's a way that can be done, and again, that needs to be coordinated with county health as well. There's also the issue of noises in neighborhoods and where cars can be and all those normal things. But from a health perspective, there's a way to do that, and make sure to coordinate with county health. It's not for every church. Most can reach more people better through streaming technologies, but certainly that's available for those on Easter Sunday. Next, please. And finally, of course, for secular Coloradans, humanist Coloradans, those who are not people of faith, it's also an important time of year. Spring is a time that we all want to have picnics with our friends. We want to venture outdoors after what has been a long and snowy winter, although there's some snowy days ahead as well. But it's important that people defer those spring traditions, defer any celebratory events associated with the spring equinox that involve different people, and just quietly reflect on spring and rebirth in your own home. For those of us who enjoy traditions like Easter egg hunting, as my family does, we usually have our kids do it with other friends and kids. In fact, we host an Easter egg hunt right here at the Governor's Mansion for members of the military kids who are stationed abroad every year. It's a wonderful event. Obviously, we're not doing that this year. With our kids, we're not doing an egg hunt with their friends. We're going to do an egg hunt with just our kids, and so we'll have some fun with it. They'll have some fun looking for the eggs, and I know that that's what families across the state and across the country, across the world, who like to engage in Easter egg traditions are doing. And as a nice craft tradition, we'll spend more time doing some of the decorating around those eggs as well. I want to thank the Betcher Foundation. They recently announced additional support for research here in Colorado, which is so important. But before we get to that, I want to introduce Reverend Amanda Henderson to talk a bit about what faith leaders are doing to serve the people of faith of our great state. Reverend Henderson is the Executive Director of the Interfaith Alliance of Colorado. She's an ordained Christian minister. She's a co-chair of the Governor's My Clergy Council. She's served as a pastor and continues to work in different communities of faith. She's been so helpful in assembling weekly calls for me with hundreds of faith leaders from across the state, and making sure that for Coloradans of faith, that we're able to get through this with the spiritual and pastoral support and the fellowship that we need at a time when that physical proximity is dangerous to that very sanctity of life that we elevate in our faith traditions. Reverend Henderson.
Thank you, Governor. Good afternoon. My name is Amanda Henderson, and I am a pastor in the Christian Church Disciples of Christ and the Executive Director of the Interfaith Alliance of Colorado. As a Christian, I'm in the midst of Holy Week, preparing to celebrate Easter. This year, my family will be celebrating virtually with our congregation, and we'll be hunting for eggs in our own backyard with just the 5 of us, though we will also do a Zoom gathering with our extended family and connect and celebrate. My Jewish friends are beginning Passover tonight, and my Muslim friends are preparing to begin Ramadan in a couple weeks, the month of fasting and honoring their connection to God. This is typically a time when we are celebrating spring and marking our holy rituals, spending time with family and friends and gathering as community. But as you know, COVID-19 pandemic has changed everything and impacted every one of us, including faith communities. While we grieve all that comes with the loss of these changes, and I share in that sadness of losing the traditions that we hold dear in this moment for this year, I also want to name that we also have an opportunity to live into our faith in new and deepening ways in this time. The truth is, the most faithful thing that we can do right now is to stay home. The way we can show love and compassion and commitment, the way we can love our neighbors, is to assure that we stop the spread of COVID-19. This means staying home and finding innovative ways to mark our holy days. We know that we can practice our faith and experience connection to God wherever we are. Congregations from across the state have been working hard to assure that people's spiritual, emotional, and physical needs are being met. Churches, synagogues, and mosques have adapted to this health crisis with creativity and heart. I've been inspired by the many things that I've seen congregations doing to build community in new and different ways, like broadcasting worship services online. Even the Red Rock service that's normally held at Easter each year will be online this year. Shabbat services have been happening every week live on Facebook, and many of my friends are sharing Passover meals online with family and friends. The Muslim community in Colorado has been hard at work making plans to be able to practice iftar virtually and to celebrate their prayers during the month of Ramadan while being apart. Additionally, faith communities are always on the front line serving those most vulnerable, and this time has been no different. Our local Sikh community has begun an in-home delivery service for anyone in need. Faith communities across the state are advocating and stepping up to assure that those experiencing homelessness have single occupancy housing. Faith communities are providing child care to first responders and assuring that those who are living alone know that they are not forgotten. In this sacred season, it is important, and we feel it in our bodies, that we are all in this together. Even though we're practicing physical distancing, we are socially connected via email, texting, phone calls, FaceTime, video conferencing, and even across our backyard fences 6 feet apart. I don't know about you, but I'm finding in this time that I feel in some ways more connected than ever to the people I love and to those who I want to assure are kept safe. So in that light, I encourage all people of faith, no matter what your tradition, to observe your religious traditions this year from home and to stay safe and stay healthy. I believe at the end of this, we will find ourselves on the other side stronger and more connected with new and innovative ways of building community and supporting one another. Thank you.
And there's also many Coloradans listening who are secular or humanist or Buddhist or might not have a particular ritual attachment to this time of year. And just understand the importance of this to Christian Coloradans, to Jewish Coloradans, and so many others. There are dates that are important to all of us on the calendar. For those Coloradans who are secular, it might be American holidays, like the 4th of July, which also happens to be my daughter's birthday, or the American Thanksgiving, or it could be a date that's important to you personally, like your own birthday or the birth date of your spouse or loved one. That's how many Coloradans of faith, view the Easter holiday, the Orthodox Easter holiday, Ramadan, Passover. And so even though if this is not important to you in your life, and there are certainly many proud Coloradans that are not part of the Christian or Jewish or Muslim faith, just understand the importance of these days to people of faith, just as you understand the importance of those days that are important to you. Imagine a 4th of July, if that's your holiday, where you aren't going out to see fireworks and having a barbecue with friends. If that's important in your life, this is of even greater importance to those who are in the different spiritual traditions. So I just want Coloradans to understand why it's important to talk about and share the different ways that we can experience fellowship at a very challenging time during a global pandemic. It's questions that Coloradans alone aren't facing. It's questions that have been faced in Italy and Spain. It's questions that are being faced in New York City. It's questions that are being faced across our entire country. I want to give you an update on some of our relief efforts. Betcher Foundation created a $1 million biomedical research fund to fight COVID-19. We know there's researchers across our state, both researchers at CSU as well as clinical research being done at Anschutz and other locations, working hard to develop and test plasma treatment, treatments, vaccines, drug therapies. Thank you, Betcher Foundation, for empowering that work. I also want to thank Danielle Oliveto and Sarah Andrews on our staff who are handling the helpcoloradonow.org work. Colorado has really risen to the occasion. And I also want to thank both Coloradans who are working with their faith organizations as well as secular nonprofits that are helping their neighbors, that are delivering groceries to their 75-year-old neighbors so they don't have to go out, and helping those in need. Thank you to all of you for doing that. We have about 10,000 volunteers who have signed up at who've signed up at helpcoloradonow.org. That's amazing that 10,000 Coloradans have signed up. We especially need those, of course, with medical training, but there's people that are needed across the board in different areas. Your services may or may not be called upon, but if you have the ability to help, the time to help, please sign up to do so at helpcoloradonow.org. And if your services are needed, there's on the form what you can do in your background, then we'll let you know. I'm also very proud to report that the Relief Fund is just under $10 million now, with $1 million raised in small donations from over 5,000 donors at helpcoloradonow.org. Nonprofits and those in need are already applying for funding, and there's $4 million going out the door right away to over 1,100 grassroots community organizations, prevention, impact, and they're going through that regularly. The whole purpose of the money you're donating is to get out the door. It's getting out the door very quickly, working with Mile High United Way and others. I also want to encourage folks to apply, and I want to be clear that in this time when we're in our homes, if anybody is suffering from domestic abuse, you should, of course, leave your home under this order if you feel unsafe. This is not an order that in any way should make people stay at home if you're unsafe in your home environment. And the order is not an excuse for abusers to traumatize domestic partners or kids. And no one should feel unsafe if you have to leave your home. If you feel unsafe, please call the Domestic Violence Hotline, 800-799-7233. Finally, more than 250 Colorado National Guard members have been mobilized and are on state active duty to help the State Emergency Operations Center and the County of Denver to shelter people in Denver that are experiencing homelessness during the COVID-19 outbreak. It's an important public health issue. It's important from a humanitarian perspective. Under my command, the Colorado National Guard is providing planners to support local emergency operations in distributed centers and non-congregated centers where needed. I want to thank the brave men and women of the Guard for assisting in this effort. And during these difficult times, especially in a season of hope, season of liberation, season of resurrection, we of course need to look out for those who are most vulnerable among us, both economically as well as at great health risk because of this virus. We all need to step up and be there for one another in this trying time. And that's what gives me the faith that we're going to pull through this in Colorado, our great Colorado spirit. Everybody working hard, doing their part, staying home whenever they can, wearing masks if you have to go out, and giving what we can so we can defeat and squash this virus and get back to a normal life and productivity and supporting ourselves as much as we can here in this amazing state that we live. With that, I'll be happy to take some questions. Stefan?
The April 26th date is still in place. I'm just wondering, can you give an overview of people that are listening and watching? What do you hear from the experts, and where are we as to the peak that's coming, perhaps?
The next week of data is going to be absolutely critical to see the trajectory, because what we're seeing now is a slowdown in the rate of increase. That's a wonderful thing, but that is from the bars and restaurants closing. We're just starting to see, like maybe today, tomorrow, the next few days, and we won't really know the impact for a full week of how much people are staying at home. And that's because of this delay factor, right? Everybody stays home, whatever percent that is. it doesn't have any effect on the number of people that get it the next day, the day after, because it takes 4 or 5 days. It can even take longer to develop symptoms, but I think a good average that we understand we can work with is 4 or 5 days. Some people have not shown symptoms for 8 or 9 days, but 4 or 5 days the symptoms. But then from the onset of symptoms to the need to hospitalization, 9, 10, 11 days as well. So we will see the impact of how many Coloradans are staying at home. And the models that were released the other day that wonderful CU researchers have put together show really different results based on whether 60% of folks are staying at home, 70% or 80%. Now, it's a little more granular than that. It's not the percentage of people that stay at home. It's the overall reduction in social mixing that occurs, right? So the people that are in a critical space and go to work, they might be interacting with almost as many people at work as they always have done. Others might be cutting off all, like my parents, they're seeing no one, right? They're both 75 and my mom has respiratory issues and they're staying home and you know, that got all their groceries delivered and all that. So it's the average that matters. And if we can achieve that 70% or greater, we'll be in very good shape. We also need to prepare, you know, for whatever comes our way. So the more Coloradans have been staying at home and are staying at home, the sooner we can end these horrible restrictions that interfere with our quality of life, our ability to earn a living, our economic growth, all of those things. And again, it's not a contest to see what you can get away with, because of course you can get away with what you get away with. It's about a contest to see how soon we can end these horrible restrictions by staying at home and limiting your social contact, and the life you save could be your own. Marianne?
Yeah, can you talk about your conversation? Can you hear me okay?
Yes, thank you for taking precautions.
Can you talk about your conversations with the White House in the last 48 hours or so regarding the problems Colorado has had getting ventilators?
So I'm in regular touch with the White House. This morning, I along with a small group of governors, the Executive Council, the National Governors Association, spoke to Secretary Mnuchin. I'll get back to the other stuff in a minute, Marianne, but there's a lot of moving parts. So we talked about some of the issues that Colorado companies are having with the Paycheck Protection Program, a great program. Secretary Mnuchin reiterated the administration's support for increasing the size of that program so that companies that need that 2.5 months of payroll to be able to keep their employees can get it. There's been great demand. This is really important because if you're in one of those, if you work for one of these companies that may or may not off, they're a lot less likely, less Coloradans are being laid off because of this Paycheck Protection Program that enables companies to have a forgivable loan for 2.5 months of payroll as long as they keep you on payroll. And for many Coloradans and Americans, we get our health care from being employed, retirement benefits. There are people who have lost their job, of course, but it would be a lot more people who have lost their job if it wasn't for that. Secretary Mnuchin, along with the governors who spoke on the call, I think it was 6 or 7 governors, and I shared some of our concerns, addressed that. We are also in regular touch with FEMA, the administration, about supplies. We are tracking that at the same ourselves through our innovation group, through the folks that are working hard for Colorado to be able to purchase supplies in the international market. We've been focused on personal protection equipment. We hope that news will get better in the days ahead. I want to thank the CSU lab, which is testing our supplies. I think there's sound here. CSU has agreed to test the materials. They already are testing masks and surgical gowns and other equipment that we've been acquiring. And of course, we continue to express our needs to FEMA. We generally make those public as well. I think you saw a letter to the Vice President and a letter, I think it was addressed to FEMA, but there's been 2 letters in the last week where we put numbers to our ass. And we appreciate any and all help. And timelines are so important because what we need from FEMA and what we need from any supplier is really the same thing. On this date, you know, on April 14th, this many masks, this location will arrive. This many ventilators, this location will arrive. But with both suppliers in the private sector as well as FEMA, what we really need are the date and the quantity so we can build it all into our overall plan. Phone?
Thank you, Governor. This is David from Henderson. As you're aware, a shipment of those ventilators were on their way to Colorado that you all had made an attempt to purchase. They were diverted by the federal government. Then today, Senator Gardner was given credit by the read on what happened here and why? And are you satisfied overall with the PPEs being provided by the government and its stockpile?
Well, you're not really going to get my read on it because I'm not here to do political analysis. I'm here to celebrate any ventilators that arrive in our state. And of course, we're grateful for 100 ventilators. If Coloradans are successful at staying at home in very high numbers, we are hopeful that the surge will be developed in time. We are continuing to both activate and adapt events in Colorado. The number of events that we have in Colorado is now about 500 more. Of purchasing, adapting, borrowing, hospital work, the FEMA 100 now. So that number available has increased, and we only hope that Coloradans are staying home enough that will be enough. And we have all of our work in place around additional supplies that we need to save the lives of Coloradans.
Any possible plans on a gradual reopen plan? Any specific detail about how things might be able to slowly reopen, 30% at a time or what have you?
The guidance around how we do business and live our lives in a safe way, because the COVID virus will still be with us on April 26th, will be issued prior to April 26th. And what we want is economic productivity, the ability to work, the ability to enjoy life. But Coloradans know not only, is, for instance, Major League Baseball delayed, but if somehow they change their decision and open at Coors Field, and Stefan and I are usually there on opening day, even if they open today, it wouldn't be the full stadium that we normally experience. And they are making those plans. They might work. They might play to empty stadiums at spring training facilities in Arizona, televised. They're looking at all those different things. But Coloradans know, well, in general, there's going to be a way that we can go back to work and live in a way that's more sustainable than to stay at home. It's not sustainable for anybody. It's so frustrating. We just need to do it for a couple weeks here and get through this. But after that date, we'll go back to a sustainable way that until the virus is cured or there's a vaccination, which someday will occur, that we're going to live in a way where it doesn't come back as a pandemic with another peak that costs thousands of lives of Coloradans. So that will be the work of the next few weeks.
Phone?
Hey, Governor, this is John here with Colorado Independent. Health experts say if we're going to lift these restrictions, such as your stay-at-home order, we need to have adequate testing and monitoring put in place. Do you expect that to be the case by April 26th? And if not, what's your response?
Yeah, there's a lot to what April 26th looks like. We will have a presentation on that before April 26th, and that includes all of the things you just asked about. It includes what are those gatherings, what's the maximum size of a gathering, what is the way that, whether it's April 26th or later, that restaurants can reopen in some form, what is the mass testing piece, and where is it, and how do you get tested, and what does it look like? Just as important as testing, remember, testing itself doesn't cure anybody, is what comes after, meaning how do you support the isolation and quarantine of the specific individuals who test positive and those who have been exposed to them, rather than the mass quarantining of society, which is what is so economically devastating to all of us, as well as just devastating to our morale. So that's the guidance that's being worked on, which will be presented, of course, before April 26th, so people can prepare for it.
Do you have a specific set of metrics or benchmarks that you're looking for before you can move to that April 26th evolution away from stay-at-home?
Yeah, I'd say the biggest data point, there's a lot, obviously, of real-time health data that we'll be looking at. Much of it gets reported every day at covid19.colorado.gov. I gave the preview with the initial numbers, but that's updated at 4 p.m. every day with the data, not just the top-line data, but you can dig down in that and get more data about who has it and where. But the biggest one is going to be how successful Coloradans are staying at home. We'll have a good sense of that over the next week, because the impact of that will roll on. And the more Coloradans are staying at home, the sooner this can end and the more lives can be saved. Very, very simple. And that's really the goal. And that the data will be out there for you. The interpretation of the data will be both our experts, your experts, outside experts can all look at that, but you will all have access to it. It's quite literally things like the number of people in hospitals, the number on vents, and the number that are diagnosed, that we expect that impact from stay-at-home. Certainly going to have an impact, already probably is having an impact, but that impact will be greater and really fully measured and felt over the next week.
Phone?
One more from phone, then we'll go to Alex.
I saw in an article today that the Los Angeles mayor is planning to put a new order in effect this Friday that all face masks have to be worn at grocery stores and drugstores, at construction sites, and taxis by those people who work there, as well as customers, and that customers could be refused service if they don't have those face masks on. Is that something that you would consider doing in Colorado?
Well, most people here are wearing masks. We go on a walk a day with our dog and our kids, and we wear masks. It's very important, and we want to make sure that, of course, when you're going grocery shopping, I think it inspires confidence when those grocery workers are wearing masks. And when I say wearing masks, it doesn't just mean the commercial masks that are available, and I see a variety here. Some of you are wearing the masks that you've acquired because you might be more at risk. Others are wearing cloth masks. The cloth masks do a couple things. Certainly they reduce the spread of the virus. They likely filter potential contagions and particulates, but even more importantly, is there touching, that you touch your mouth and nose. So you might touch a surface that's contaminated, and without even thinking about it, dozens of times an hour or some statistic like that, people just touch their nose or mouth, and you can't do that if you're wearing a mask. So that's the true benefit, and why it doesn't replace staying at home. You need to stay at home except when you absolutely need to go out. But when you do, you're a lot safer if you can wear a mask, and that's incredibly important, both for keeping the workers safe in those frontline industries like grocery stores, as well as keeping yourself and your family safe. Alex?
Eric's question, obviously you're saying testing itself doesn't cure anybody. We know that, but it does help guide the strategy. And so it sounds like you have more specifics coming before April 26th about what testing we're going to need, what that system's going to have to look like. But can you share, are we anywhere close to adequate system of testing to open the state in any way?
Well, if we had the adequate testing today, the state still wouldn't be open because there is 10, 20, 30,000 people with COVID-19. Where the societies that have been successful with this, meaning countries that are still operating at close to normal industrial capacity, areas of the world like Taiwan, countries that have managed this effectively even though it exists and are back to something closer to their normal way of life. They've been very successful at, of course, testing, but then with testing comes the isolation of individuals and those who've been exposed. And so, yes, the goal will be for us when we reopen. There's obviously, testing has already gone up a factor of 10 times here in Colorado from when this started, and it's working on increasing it all the time. But the need will be greater at that point. And that will be the way, and it's not just testing, that's just one tool. It's, you remember when we all went into the EOC and we had our temperatures checked. That was actually the way they were able to catch the person that had it there. The temperature was elevated. Otherwise, it might have been another day or two where that person went to work before severe symptoms manifested. Again, unfortunately, there's 25 to 50% that might be asymptomatic, might not even have fever. And for those who encounter a lot of people, testing is also important. So there's a lot that will go into that strategy, and that will be, again, presented prior to April 26th around what that looks like. But don't think just testing. Think temperatures, think masks, think testing, yes, and testing of two kinds, the serological testing for blood for the antibodies and the testing nasally for the virus itself. Maria?
So we have received a question from Intervision. Let me read it for you, Governor. Gobernador, ¿cuáles son las opciones que tienen los inmigrantes indocumentados para obtener ayuda del Estado?
Desafortunadamente, no todos los residentes de Colorado son elegibles para la ayuda económica federal. Para mí es muy importante que ayudamos a todos los residentes de nuestro estado. Por ello, mi equipo está trabajando con el sector privado para recaudar fondos para medio de el Help Colorado Fund, helpcoloradonow.org. Muchas organizaciones que ayudan a refugiados y inmigrantes tienen prioridad para recibir apoyo económico y así ayudar a nuestra comunidad inmigrante. Gracias por la pregunta.
Governor,
That's good.
can you explain a little bit more about why the data that comes out next week will be absolutely critical? And also, can you talk about how you came on April 26th as the date to end stay-at-home order? What was the thinking behind that? Was it arbitrary? Was it...
The reason that the data of the next few days is so important is because of the timeline that we presented a couple meetings ago. Any step you take shows no impact on the spread of the virus in 1 day, in 3 days, even in 4 or 5 days. Because when somebody's exposed to the virus, it takes 4 or 5 days for symptoms to manifest. As I said, there's reported cases where it's 8 or 9 days, but there's the bulk of it 4 or 5 days after. And those first symptoms are often manifest slowly, meaning you get more sick later. So you get those first symptoms, and the average time to hospitalization from when you get that first symptom is 8 to 10 days. So you're talking 12 to 15 days before any measure that we take has any impact on who's actually in a hospital. And that's what we're worried about here. 9 in 10 people won't need to go to the hospital who get COVID-19. It doesn't mean it's going to be fun. You might go through a lot at home, but you won't need medical intervention to save your life. 1 in 10 need hospital facilities to help give them that fighting chance of saving their lives, and many of them make it through. Often cases that's oxygen, and of course the more extreme and the final intervention, which could be a ventilator for the 1 or 2 or 3% that need that. But the hospitalization is what we've been focused on, having that capacity. We want to do everything we can to make sure that Coloradans who can make it through COVID-19 have that fighting chance to make it through by having the hospital beds, the oxygen, if necessary, the ventilators, to have that fighting chance to make it through. So our decisions around timing are tied into the decisions around hospital capacity. There was a presentation on that, and we can provide more info as well on the specific goals around the addition of hospital beds, the impact successfully of delaying elective procedures, the work the hospitals are doing, and the work the state is doing to provide the step-down facilities, because we need to free up those beds for people who need them. So somebody who might no longer need hospitalization but is still contagious and lives in a nursing home is not discharged to the nursing home. They need to be discharged to a facility where they can be monitored and kept isolated and away from others who might be vulnerable. That's a lot of the expansion work the Colorado National Guard is involved with and the state is involved with to help those hospitals free up those beds sooner rather than later. Okay, we'll go to another in person. Yes.
Governor, what are your thoughts about the Air Force Academy deciding to go ahead with its graduation, but without spectators?
Well, every school district in our state is
figuring out how to do commencement, as are our institutions of higher education. They're all making the best decisions that they can. Some are, hopeful that the students will be able to return physically in some way with social distancing at some date early summer. Others are moving to a virtual kind of commencement. Others are saying they'll march next year or with next year's class. I mean, we all want these rites of passage to be meaningful, especially for our Air Force cadets who work so hard at the academy, but for all Coloradans who are graduating from high school, from college, from 8th grade. It's important to have meaning in these rites of passage, and school districts, universities, the Air Force Academy are all really doing their best to figure out the best way to provide meaning without putting the lives of those graduates and their families at risk.
Governor, can I ask you, there have been firefighters and lawmakers, and this may seem like an out of the blue question, but has there been any thought, you personally or within your administration, to perhaps lowering the flags to half staff?
I think that there will be a time for mourning. There are more victims ahead of us than there are behind us, and it wouldn't be for any one particular victim, but rather collectively for what we're suffering through. And I think that there's a time and a place for that. Right now, the most important thing is that we save lives by staying at home. Of course, our communities across the world are reflecting on our losses, but we know that there are many more losses ahead.
I'm hearing stories from people in the real estate community that one of your executive orders may be forcing people into homelessness that perhaps wasn't intended. This has to do with transactions, real estate transactions, and people are allowed to go to closings, but the people who are selling their homes are not being allowed to find replacement housing. And I'm hearing stories from at least 2 families right now that they expect to be homeless within 2 weeks. Is that what your intention was?
No. If there's an issue there, we'll fix it. Closings can occur.
Notaries can do their business remotely. Closings can be attended in person. Houses can be bought or sold.
Because of how the Attorney General interpreted transactions, they can do the closings, but I have 2 families right now who said their homes are they're going to closing, and they have nowhere to go. The new owners are going to get possession of their homes. They're out of the house.
Well, just as they can close on the selling of their home, they're in the other scenario, they're the buyer of a home, they can close on that too.
Haven't moved far enough along in that transaction process.
Yeah, so homes are being bought and
sold. And actually the closings can actually be attended in person. The notaries can notarize virtually. If there is any need for further clarification, we're happy to do that. But houses are being bought and sold across our state. So just as that person you're talking about, they are clearly going to the closing where they're selling their home, just as they would also be able to go to the closing where they're buying a home. It's just another seller that's there. So they can, just as when they're selling their home, Mary Ann, the buyer of that home is also there. They're the ones who made the closing. So it's just they're also able to be on the other side of that table as a buyer if they want.
It's the people who have sold their homes who are in trouble.
But you're saying they want to buy a home. They can still buy a home just as somebody bought their home.
Told they cannot.
Well, I'm telling them they can. So and it's happening. I mean, they are doing it. I mean, you might have heard
from 2, but people are buying and selling homes.
Inspections are going on still?
Yeah, inspections are critical and fine, and there's no issue with those. And we're encouraging in those closings that unnecessary people aren't there. In a normal home purchase, it's really just the buyer, the seller, and maybe a lawyer. I mean, for large corporate things, they're paring down a little bit in terms of who has to be present. But those are occurring. Any encumbrance to that, any difficulty,
we're happy to help streamline that. They're already, again, the notary piece can be virtual. That's a change from a temporary change under the emergency order from the law before. If there's anything else that can be done virtually, it's a great way to do it, but for what needs to be done in person, it's most important that those transactions take place because everybody needs a place to live. And just as you can sell your home, you can also buy a home. People can rent homes. All of that is occurring right now in Colorado. If there's 2 people who have trouble, send them to our office and we'll make it clear that they can do that because it's happening across our state. I mean, I don't have the numbers of transactions. It's down a little bit from the norm, Mary Ann, but there are many transactions that are occurring.
Question on the phone.
One more on the phone and then
in person.
This is Natalia Navarro from CPR. Back to testing. Is the state on track to have enough tests by April 26th to do mass testing, like any kind of test, whether that's antibody or another kind?
Yeah, so we will have a presentation on that topic closer to that April 26th date, but before that April 26th date, so folks are aware of what that looks like. And yes, it involves much greater testing. It involves temperature checks. It involves steps that we can avoid unnecessary gatherings and guidance. All of that will be presented shortly before things go that way, and that it's being planned in a way where it can be rolled out in the real world, and we'll make sure that that guidance is available. Some of it is even after April 26th. For instance, schools, again, unless this gets worse and it has to change, schools are closed through April 30th. Now, some districts have canceled for the year, but for those that will be reopening May 1st, they'll have some guidance around what that looks like for school on May 1st. So and again, it's not exactly the same as school was in January or February. Everybody knows that, but those parameters will be issued for those classes that are resuming.
But Governor, what has to happen to actually manufacture and access the right number of testing kits to make that happen by?
I can give you an update kind of on what right now our in-state testing capacity. By the way, we're conducting about 10 times more tests per day than when this started about a month ago. Our capacity is greater, meaning we can process between our hospitals and our state lab at least 10,000 tests a day. The main reason that that number is closer to 2,000 now is two reasons. One is lack of reagent, meaning we don't have the viral reagent for those tests. We're acquiring that. The second is simply the capacity of the healthcare system. I mean, obviously prioritizing the clinical care of people who need it is above testing. It's really important that people who think they might have this stay at home. And I said this the other day, but I just want to be clear about this. 90% of people who have this virus will not need medical attention or care. They need to stay at home. The last thing we want is 20 or 30, there could be 50 or 60,000 Coloradans experiencing some kind of flu-like symptoms, right? I mean, maybe less than half have this one. You might have something else. We don't want 60,000 sick Coloradans scrambling around to hospitals and other places trying to get tests when that test doesn't inform anything. You do the exact same thing, whether it's COVID-19 or the flu or whatever that is. You stay at home and try to get better, and you seek out medical care if you urgently need it, right? No matter what that condition is. So the situation would be much worse if we had 60,000 Coloradans scrambling around our hospitals, distracting and taking the time of our medical personnel who need to be treated, those who need the most medical interventions, rather than staying at home, try to get better, whether it's COVID-19, whether it's not. If it's COVID-19, 10% might need hospitalization. If it's influenza, maybe 1% or 0.5% would. Some will anyway. But no matter what your symptoms are, unless you need medical care, isolate yourself, stay at home. And yes, the testing will increase, and it has increased, and it will increase, and it'll be a much bigger part of our lives. But we don't want people scrambling all over and risking exposing themselves and others just because they want that psychological certainty, which doesn't, I know it's frustrating because you want to know, do I have a cold or the flu or COVID-19? But there's nothing different that is done for you while you're trying to get better, no matter what your condition is. The diagnosis doesn't mean anything in terms of what you do. And in any of those, whether you have, I should say if it's bacterial, it's different. You might need an antibiotic. If you have strep or staph, there's a different treatment. But if it's influenza, if it's cold, if it's COVID-19, it's the same. If it's bacterial, you might still need that strep test or whatever that is. But unless the symptoms indicate and your doctor indicates that you need to visit in person, it's best to isolate yourself and stay at home to avoid others contracting whatever you have. Yeah.
Part of what happens after April 26th. Will we have enough reagent and other materials to actually institute it?
Yeah, the decisions around how the testing occurs will be tied into the quantity of testing we have April 26th. We're not going to have a condition where you need a different amount of tests than we have. So is it, it's constrained by what we can do, not just in terms of reagents, but also just in terms of where and how the testing is done. So testing will be done at a much greater scale. Those details will be forthcoming. And don't think just testing, also think things that are instantaneous and quick, like temperature checks and other measures that will be in place as we return to more normalcy. Any final question?
Yeah, Governor, I want to follow up. You didn't answer the question about why April 26th.
I think that that's a realistic date that we can achieve as long as Coloradans are staying at home. So if Coloradans aren't, this is going to get worse and much worse, and we'll need more space and more equipment, and it'll need to last longer. If Coloradans are succeeding in staying at home, with the timeline of the virus, meaning everything we've talked about, the time from exposure to getting it, to symptoms, to being hospitalized, there'll be enough time for us to have the data we need to offer Coloradans the security they need, that if Coloradans are staying at home in sufficient numbers, we should be able to have a much greater degree of return to normalcy by April 26th. If that can happen a day or two sooner, no one will be more excited than me to do that. We'll all be excited to do that. It's also possible that if Coloradans are not staying at home and the virus is still spreading and the bodies are piling up even at a later date, at a greater rate, that could need to be extended.
You have a lot of realtors that are watching right now, at least on our Facebook, and they just want, are you aware that showings are not allowed right now? And some people want to know, why is it okay to go to the grocery store, but I can't go as a realtor show to a potential buyer or seller?
Yeah, I'll have to ask on the clarification of that. I know that many realtors are doing virtual showings, but it's not the same thing. There should be a way that people can engage in those kinds of activities. But the more we are staying isolated and staying at home, the quicker we can reopen. So all of these things are very important, and people say, why not have this store and that store and this kind of office and this kind, and every one of those are all essential parts of our economy. But the more that are interacting, the lower that social distancing number is, and the longer these, not just the longer these horrible restrictions have to stay in place that we can't wait to end, but also the greater the death toll will be, and the more people will contract the virus, and the less time we have to build the capacity in the healthcare side. So it all ties together. We want, my overall guidance is the maximum amount of economic productivity, economic transactions, commerce, market activities are our friend. We want the highest possible number with the minimum amount of physical proximity. And so that's why, some kinds of classifications of stores have gone to curbside. It's why restaurants are doing delivery. It's why we're doing virtual notaries. It's anything that we can do that facilitates commerce and trade that does not bring people together physically. We want all those ideas. Post them on our website. You can go to the Governor Jared Polis Facebook page. You can tweet at us. Any ideas you have that there's more trade and transactions and commerce that can occur without more people having to be together. That's exactly why we've cut red tape, reduced regulations. We've allowed people that, for instance, are bussers and waiters at restaurants to not have to go through another insurance hoop to be in delivery. It's why we facilitated virtual services. People can do everything from state services, like renew their driver's licenses, and many other things that had to be in person can now be done virtually or online. That's exactly what we need to be able to get through this as quickly as possible, because this is a challenging time, not just around our faith traditions, which we led with and I'll end with, but also a challenging time economically for the people of our state. But, it gives me faith that people of Colorado are showing our big-hearted spirit. People really understand the reason that we need to stay at home except when absolutely necessary, and that we need to wear a facial covering when we do go out. And that's what's important. No one, if you're not doing that, you're not cheating anybody except for yourself, because if people are going out and mixing and socializing and not wearing masks, it prolongs this difficult time for the rest of us, and it ultimately costs lives. And that life could be somebody you've never met and never know, and just a statistic to you, but it also could be your uncle or aunt or your brother or sister, and it could even be yourself. Thank you all.
Governor Jared Polis wrapping up about an hour-long update on COVID-19, the situation in Colorado. Maybe the most alarming moment came when he was asked about the possibility of bringing Colorado's flags to half-staff for those who have passed on. This as the death toll in Colorado climbs to 190. He mentioned today we have more victims ahead of us than behind us. And again, the death toll now stands at 190. It was 11 days ago that the death toll on March 29th went over 100 in Colorado. It is now creeping closer to 200. Much of the rest of the address had to do with the religious aspect of this week. Passover starting tonight, Easter, of course, 4 days away on Sunday morning. His message was to count your blessings amid all of the struggles that we are enduring right now as a state, as a nation, and as a world. There's a lot to cover there. We will be doing so in about 2 hours when we join you for more on 4 o'clock at 9 News.